Thanks everybody again for joining us today for our webinar. So this is our Closing the Gap Network Plus Kickstarter funding guidance webinar, and we're joined today by a great team of people on the webinar. So just quickly run through. So you're going to hear from Emily Peckham, who is our network coordinator. You're also going to hear from two of our network theme leads. We've got Piran White and Debbie Maxwell, who are going to be here speaking out specifically about their themes. And we're going to hear from Piran in a minute, who's going to introduce the network. We're also very lucky to be joined today by Karen Bloor, who is on our network steering group and funding decision making panel, and she's going to be giving some top tips for applications. Unfortunately, Paul hasn't been able to join us today. He was sometimes provides us some tech support, and then you've got myself, and I work for Cochrane Common Mental Disorders, one of the partner organisations of the network. Okay, so what's the webinar going to be focusing on today? So we've divided the webinar into 3 parts. So the first part is going to just give a quick overview of what the network is, why we're here, and what the causes of that mortality gap are, and we're going to have a bit of a discussion and introduce you to some of the themes, and we've got, as I said, some of the theme leads here to talk about that. And that's because not everybody on the webinar might be as familiar with our networks. We think it's really important to do that. And then the main part of the webinar will be talking about our Kickstarter funding round and just going through that core guidance and talking about some of the specific questions that we've already had through, and just trying to provide you with a bit more clarity. And then finally, we've got part 3, and in that we're just going to go into a bit more detail briefly about our research framework, some of our network research aims, goals and questions, and we hope that some of that information might help you in terms of formulating your project ideas if you haven't got those already. Okay, so just showing the responses now, it looks like today we've actually got quite a lot of researchers on our webinar. So hopefully we'll be able to tailor some of our answers to questions later on to be a bit more specific, and that's helpful for us to know in terms of how we're pitching some of our responses, to know that most of you today on the webinar are researchers. Okay, so I'm just going to end that poll. So thanks everybody for contributing to that. There'll be a few later on just to make sure you're still listening. Okay, so before I start, just again, we wanted to just say a big thanks to all of the founding partners of our Closing the Gap network, and they're represented there on that slide. And we are hoping that over the course of our Network Plus, we'll be able to expand that to include lots of other partners. So really looking forward to getting our applications into this first funding round. So I'm just going to now pass over to Piran White, who's going to talk you through what the gap is and how we got there. Okay, just handing over to Piran then, thank you.
Hi everyone, so thanks for joining the webinar today. So as Jess said, I'm just going to introduce what the gap is and talk a bit about the background to the network and the gap itself. So we're one of 8 networks funded in this initiative by UK Research and Innovation. So we're based at York, also have partner organisations in London and Kiel. And if you look at the bottom, it tells you what UKRI is. So as all of you researchers, you'll be familiar with that. So it's the umbrella organisation for the various research councils in the UK. So just a bit of background to the project. So people with severe mental ill health experience some of the most profound health and mortality gaps in relation to any section of the population. And our network is focusing on people with severe mental ill health, and here we're including examples of disorders include schizophrenia, bipolar disorder, and that sort of thing. So the network isn't about general mental health or general well-being. We're specifically targeting people with severe mental illness. So if we look in a bit more detail at some of the problems facing this particular population, then some of you may be familiar with this graph. What this shows is trends in life expectancy over the last 30 years, both for the general population, which are the darker red and the darker blue lines going upwards near the top of the diagram, and the F20 population. So this is males and females with schizophrenia. And if we look at general population, those two graphs for the males and females, we can see that there's been a general increase in life expectancy from the 1980s up until 2010, and this has been a year-on-year consistent trend. If we look at the other two lines, this is for the F20 population, the people with schizophrenia, then if we look back in 1980, you can see that actually life expectancy for this group of people was fairly similar to the general population. But since that time, the general trend has actually been a decrease in life expectancy for this particular group of the population. So whereas for the general population, we have an increase in life expectancy, for these people with severe mental ill health, we've got a decrease. And what's frightening about this graph is that this gap is actually getting worse. So now the gap in mortality between our people with severe mental ill health and the general population is actually significantly larger than it was, and it's continuing to increase. So the net effect of this is that life expectancy for this group of people is reduced by around 20 years. So that represents a huge inequality. And that's really what we're trying to do in this network, is to try and understand that inequality more, that gap more, and also try and therefore think about how we might be able to start to reduce it. So if we unpack this, what's behind this gap slightly more. So what these graphs show is this is data from Public Health England, and it shows the relative prevalence of long-term physical health problems for people with severe mental illness relative to the general population. And these are for different types of problems. So we've got obesity, asthma, diabetes, pulmonary disease, coronary heart disease, stroke, and heart failure. And on average, people with severe mental illness are 2 times more likely to have these conditions than the general population. And so the net effect of that is that the prevalence of these various health problems for people with severe mental illness is increased several-fold. So this is an extremely significant problem. It's one that's under-recognised, and the important thing is that it's getting worse over time. So we really need to try and do something about this to reduce this mortality gap. So obviously this isn't a straightforward problem, and the causes of this gap are complex and multiple. So what we're trying to do in our network is try to understand some of these causes and think about how we can use this understanding to try and find solutions. So what drives these gaps in health and mortality for people with severe mental illness? So we've already seen from those graphs that there's various chronic, preventable and modifiable physical health problems that affect this particular population to a greater extent than the general population. We also know that behaviours that pose a risk to health, such as smoking in particular, but also poor diet and inactivity, are all more prevalent in this population. We also know from work that's been carried out previously is that there's wider social factors such as unemployment, deprivation in living conditions, housing conditions, poverty, etc., are also more prevalent in this population. So all these contribute and interact with some of these other physical health problems. So in terms of the causes, we know that there's many problems that are all interacting, and these health problems are linked with the social factors and exacerbated by them. But we also know there's failures in health services to address the needs of these populations. So we know that the provision of care is suboptimal and has been for some time for people with severe mental ill health. And also we know that there are other exacerbating factors. So for example, some of the effects of medication to deal with some of the physical health problems. For example, some of the antipsychotic medication can lead to weight gain, and that can lead to the development of type 2 diabetes. So we can see that many of these physical health problems, these mental health problems, are interlinked. And in addition to that, there's a lot of social stigma attached with mental ill health, which can lead to people with severe mental illness becoming isolated, feeling socially excluded, etc. And that again can contribute to exacerbating some of these physical health conditions. So how we're looking at this problem is that we're using a well-established model in public health, which is the social determinants of health model. And we're using this as a roadmap to guide our research. So in this model, people are represented in the center of this diagram, and there's a whole range of factors around people, starting with their age, sex and hereditary factors, then their lifestyle, the interactions they have with their community, where they live and work, the environment in which they live and work, both the built environment such as housing conditions, etc., but also their working environment, and then the natural environment. And this goes out, this extension of this original model goes out right to the global ecosystem, and how the global ecosystem supports people's living and working, and through how it functions. And so that links to other concerns such as changing climates, change, etc. So we're going right from the individual right to the global kind of ecosystem. So this is obviously a huge kind of realm of things that can potentially affect people's health. And so we're focusing on some specific things within this and looking at some of the interactions between different parts of this model. But we're using this as the roadmap to guide our research. And it's specifically, we're looking at not only what happens within some of these different layers, but also how different layers in this model interact. So how are we going to tackle this then in our network? So our overall focus is to understand and work to reduce the physical health and mortality gap experienced by people with severe mental ill health. And within this, we have two specific aims. One is to understand the causes and consequences of this health mortality gap. And then the second aim is to identify the most effective ways in which we can start to mitigate these causes and consequences. So that includes how we might start to develop more effective policies, or how we might intervene on the ground. So what we're hoping to do is to kickstart innovation in this area. There's been quite a lot of background research, but in terms of determinants of health, but there's been relatively little looking at people particularly with severe mental illness. And another way in which we're innovating in this network is that we're using a highly interdisciplinary approach. So we're drawing on expertise not only in public health, but also across the arts, across digital technologies, across economic and social and political sciences, the environmental sciences, and so on, and bringing these together in cross-cutting research foci and cross-cutting research themes. And we're hoping that by doing this, and by working with people with lived experience and with our stakeholder community, this is going to result in new innovations in this area, but also to build capacity, not only to undertake research in new ways, but also to mobilize knowledge about how best to develop policy and how to make a difference in practice. So we are based in York, but with other groups in Kiel and London, but we're not just working in Yorkshire, we're working throughout the UK, but also many of us have partners in different countries in the world. So as we progress, we're going to build this network into an international network so that we can start to think about how we can leave a legacy most effectively, both for the research community, but also for those working in policy and practice, and most importantly, for those with lived experience of severe mental illness. So we've developed a framework for looking at how we're going to tackle these problems. So you can see here we have two aims. The first aim A, understanding causes and consequences of the health and mortality gap. And then aim B is to identify the most effective ways to mitigate these causes and consequences. So within this, we're looking at this using 4 research foci, which are co-design and creativity, digital technologies, green and blue space, and big data, and then 2 cross-cutting research themes that are health and social inequalities and knowledge mobilization and impact. And then within each of the aims, looking across all of these themes and foci, we've developed specific goals and also have worked to develop specific research questions. And we're going to come back to those towards the end of this presentation. So first, I'm going to give you a quick run through of our research foci. So there are 4 of these. So the green and blue space one, I'll talk a little bit about after these slides. We also have a big data theme, which is being led by Marina Jacobs, which is looking to how we can harness the increasingly large data sets that are coming out around health, but also around other potentially influencing factors like the environment in which people live, how we can harness them to better our understanding of the causes and consequences of this gap. Lena Geiger and Sebastian Detterding are leading the digital technologies focus, where we're looking at the potential of digital technologies like new apps, smartphones and so on to try and improve physical health of people living with severe mental illness. And Debbie Maxwell is leading the co-design and creativity theme, which she'll talk about in a bit more detail very shortly. Then we have the two cross-cutting research themes. So one is the health and social inequalities theme, which is being led by Kate Pickett and Stephanie Prady, which is looking at investigating the profound health inequalities that are being experienced by people in this population. And then finally, a knowledge mobilization and impact theme, which is being led by Wanda Wiporska and Rachel Churchill and Kate Pickett. And in that, we're looking at how we can start to translate the research that we're undertaking and also research that's been undertaken previously in this area into policy action and clinical practice. So we're just highlighting a couple of the themes today. So one's the green and blue space theme and one's the creativity theme. So in the green and blue space theme, so I'm co-leading this theme with Pete Coventry. And what we're interested in this particular theme is understanding the effects of nature and ecosystems on people's health and well-being, and particularly people with severe mental ill health. So there's been quite a lot of research and increasing research on green and blue space and the benefits that it can bring in terms of general mental well-being. But there's been relatively little that's looked at particular groups in the population, and especially people with severe mental illness. And we know from research that we've undertaken is that the benefits that we see from green and blue space for the general population probably aren't experienced by people with severe mental illness because of various other factors, such as some of the physical health conditions we mentioned previously, but also some of the behavioural factors of social stigma and exclusion and so on. And they're very often practical issues, like issues of access to these spaces, which can be down to transport links as well. So we're interested in understanding how people with severe mental illness interact with green and blue space, and whether they do this in a different way than the general population, or whether, and that will be really useful for telling us whether we can use insights from studies onto the general population and we can translate those directly to people with severe mental illness when we're thinking about ways in which we might be able to mitigate and use green and blue space to mitigate some of the problems of this mortality and health gap. And then once we've done that, we're also then want to think about how we can start to deliver benefits for this group of people in terms of improved physical health that use green and blue spaces in new and exciting ways, so we can increase the interaction, increase the benefits for this group of people. So that's a green and blue space theme. So now I'm going to hand over to my colleague Debbie Maxwell, who's going to say a bit more about the research focus on co-design and creativity.
Thanks, Perrin. I'll just turn on my video so you can see me. Great. Okay, I hope everyone can hear me. Yes. So as Perrin said, I'm the theme lead of the co-design and creativity strand. And I'm a lecturer in user experience design at the University of York. And this theme really seeks to pose and answer the question, how can we use co-design and creativity to improve physical health and well-being of people experiencing severe mental illness? And well, artistic and creative practices, so drama, creative writing, poetry, painting, craft, music, etc., have been shown to be effective in the expression and recovery of people experiencing psychosis and severe mental illness, helping to reduce stigma and social isolation. From my background, from my fields of interaction design and human-computer interaction, participatory design practices, so that's working with end users of software or digital technologies in some way, and stakeholders have been shown to be really effective in terms of designing, going through whole product life cycles, from scoping and reframing of problems through to idea generation, to actual solution generation and prototyping, and evaluating solutions as well, and designs. And these approaches, this holistic participatory approach, has been applied across a whole wider range of design contexts, including physical activity, mental health, and technology. And these approaches tend to have quite an empowering way of working with people. And certainly in my experience of working with voice hearers and arts and humanities researchers, co-creating sets of materials around listening, and this was the case that our participants are people with lived experience, not only got actively engaged with the research and design process, but actually shaped it and helped to shape the research questions. However, to date, there's been little work on co-designing or participatory design with people with SMI, with severe mental ill health, to improve physical health through creative practices. And therefore, the aim of this strand is to explore the rich potential, really, of creative practices and co-design to both understand and improve the physical health and well-being of people with SMI. So there are a whole range of questions that could be posed through this theme, and I believe that some of these might be covered towards the end of this webinar today. But some of the ones that could be explored, and that I'm kind of keen as theme lead to see explored, is how can we meaningfully bring people with SMI, with lived experience of this, together with medical professionals to creatively understand and explore the barriers and opportunities for engaging in physical health activities. So bringing this a creative approach to research as well, the methods and methodologies to bear on that too. And then secondly, perhaps to explore how design thinking tools might be used to reconfigure and augment existing creative practices. So for instance, once we know what the creative practices are that are being adopted, how could we co-create and hack and augment new versions of them, explicitly aimed at increasing well-being and physical health? And then possibly a third question then could be around exploring how taking part in these types of processes and research activities themselves might actually affect sustained engagement with health interventions. But I think the key thing really for me in this theme is that I think it'd be difficult to do work in this area without working with people with lived experience, but also extending beyond that and thinking about this as quite a collaborative theme as well. So perhaps partnering or working with creatives, whether that's organisations or perhaps independent creative practitioners, as well as researchers in higher education institutions. And really this kind of co-design, co-production focus of the theme really relates to the cross-cutting things across the network as well. And so I'd really kind of welcome proposals for this theme that draw upon this and use creative practice to actually kind of explore research questions as well. So that's all I'm really going to say on this now. I'm happy to answer any questions about the theme at the end. But I'm going to hand over to Emily Peckham now, who's going to provide some details on the funding call itself.
So our first funding call is looking to offer short-term support to allow investigation of new ideas, collaborations and partnerships in the area of severe mental ill health. And we really want to stimulate research into the inequalities that people with SMI experience and to build cross-disciplinary research capacity. So we've got two key aims as part of this funding call. We want to understand the causes and consequences of the health and mortality gap, and we also want to identify the most effective means to mitigate these causes and consequences. So that's what we're looking for research that's going to address. So some key information. The project should have consist of a well-defined activities and must have a clear objective. We're going to fund projects from £2,000 up to £30,000, and projects should be planned for a period of up to 12 months, and they're to be completed by the 31st of November 2020. So, is my organisation eligible to apply? Applications must be led or co-led by a UK higher education institute, and that's due to UKRI funding requirements. So non-academic bodies, charity, third sector organisations and other relevant bodies are welcome to apply, but they're going to need to have a higher education institute as the lead or be co-led by a higher education institute in partnership. And we would really strongly encourage projects that are co-led by HEIs in partnership with non-academic groupings. So we really want to bring in other people into the research and form these collaborative groups and not just have HEI partners involved. So we're just coming on to our next poll, which is, have you identified an HEI partner if you need to? Okay, so we've got a mixed response here. We've got some people who have identified a partner and some people who haven't identified a partner. If you're having trouble identifying a partner and you need any help or support in identifying a partner, please do get in touch with us. Applications, including early career researchers, are strongly encouraged, and that's either as a co-investigator, where the applicant is yet to gain an independent permanent position, or as a PI if they're in the early stages of an academic career. If they're in the early stage of an academic or research career with a long-term position. So if the main applicant is on a fixed-term contract with a contract end date before the end of the project or very shortly afterwards, a further project supervisor who will take over and oversee the completion of the project will also need to be named. So, now on to our next poll. Are you an early career researcher? Got quite a mixed response in terms of who's responded. So we've got some early careers researchers and some non-early careers researchers. So thank you for completing that poll. It's useful for us to know the scope and the different types of people who are interested in applying for the funds. So we'll move on to the next slide. So how do you decide who gets funded? So this is how our decision-making panel are going to decide what gets funded. So we've got an independent shortlisting panel whose members will assess and score proposals against predefined criteria. And you can find these criteria within our funding guidance document, which is on the website alongside the funding application document. And the criteria are research excellence, feasibility, engagement and collaboration, value for money, and ethical issues. And we've got more details about how these will be scored on the guidance form, and then you can see on the next slide that gives you a bit more detail. I won't run through all that, but if you want to go back to the slide deck afterwards, you can look at the details, or you can look at the funding guidance document which explains all this as well. Just to say that each of the 5 criteria will be scored on a 0 to 5 scale, which will lead to an overall score. So what must my application cover? It needs to have a clear description of the project aims and possible impact if realised. We need to have a summary of the evidence that currently supports the concept of the project and the gap in the current body of evidence. A project plan and commentary on the significance of the results intended to be obtained. And this should include a statement on how the project aligns with our core principles. And you can find the core principles of the network again in the guidance document. And we've also got a document up on our website which lists the key research questions that we're interested in answering and also contains our core principles. It must also cover the longer term impact and potential for further development of the project. Plans for sustainability in terms of funders, funds and future partners. And finally, plans for dissemination of findings. So here we are with our core principles. So our core principles are sharing, the need to be participatory, inclusive, engaged, innovative and outward facing. All our Closing the Gap activity will be sharing, so these are a bit more details about our core principles. So sharing, by sharing we mean a collective vision and endeavour, participation, co-production and co-ownership. By participatory we mean involvement of people with lived experience in the research and active engagement with those involved in policy, delivery and practice. By inclusive we mean a sensitive and supportive approach and commitment to understanding contextual basis. By engaged, we're looking at integration of local advocates and community members into the network activities and working with people with lived experience. Innovative, commitment to novel approaches and commitment to interdisciplinarity. And outward facing, effective communication and knowledge exchange before, during and after research. Engagement with external research community and policy and delivery relevant. Your research may not be able to address all the core principles of the network, but we're looking for it to cover at least a few of these core principles and you to highlight how your research will cover some of these core principles. So how much should I really bid for? We will fund projects from 2,000 up to 30,000. The maximum size awards, and these for larger projects, are up to £30,000. But applications should be aligned to the appropriate funding required to carry out the activity. We anticipate that the majority of the projects will be in the region of £10,000 to £15,000. The total funding available in the round is £100,000. So what will the costs cover for? In your application, you will need to show the 100% of full economic costs of the proposed research, but we fund 80% of full economic costs in line with UKRI guidance. For more information about what full economic costs are, you can follow the link below. So these are our allowable costs. So funding may be sought to cover the direct expenses incurred in the planning, conducting and developing the research, and this includes project planning and development costs, research expenses, participant reimbursement, transcription, consumables, short-term consultancy or salary costs for expert staff or short periods of research assistance, travel and subsistence, investigators' time, so the cost of principal and co-investigators working directly on the project. Investigators' time, but not the cost, must be justified in the application. And then administrative costs. They may be included, but they should not constitute more than 20% of the total application costs. And estates and indirects. So here we can, on the next slide, we see the form taken from the application form, which shows where you can fill in the costings. So you can see there's a column there for 80% of the full economic costs, and another column so you can show the 100% of the full economic costs. What we've put, how we've imagined people complete it is that you can either say, for example, materials and consumables, you can put the complete total, or you can break down it into separate items. It's entirely up to you how you wish to break that down. So that's why there then is the final column of total. So that's if you wish to break down some of the columns into separate items, then you may do so, and then you just put the total for that cost into the total, and the total is the 80% FEC. If you're at all unsure about filling out this cost, please do get in touch. So what's not currently eligible for funding? So awards will not be made retrospectively. So this means that work for which support is requested must not have commenced before the award is announced. We won't fund computer hardware, books or other permanent resources or publication costs. So the project must provide value for money. So are the funds requested acceptable in relation to the planned work, and are the outcomes likely to be achieved? Does the proposal demonstrate value for money in terms of the resources requested? Will the proposed project add value to the research field? And will there be funding resources that we contributed from outside this funding stream? So, for example, if there's somebody who's going to work on the project but you've not costed in, then it's worth highlighting that in the application. Or if there's any other in-kind type contributions going to be made, again, please highlight that in the application. And we've got a separate box where this can be highlighted, as you can see from the next slide. Will funding resources be contributed from outside this funding stream? And that's where you can detail any things that will be funded in terms of cash or if in kind. And those will be looked upon favourably. So how do I submit my application? All application forms should be submitted to our Closing the Gap email address, which is shown there. Emails should carry the subject line CTG funding proposal and then the applicant's surname. And they must be received by 5 PM on Monday the 30th of September 2019. And you can download the application form from our website. Note, you need to include a CV for the principal applicant and any co-applicants. The CV should not be included, should be included at the end of the Word application form, and CVs must not be sent as separate files, and they should be no longer than 2 sides of A4. You must attach the CV or your application will be automatically withdrawn, and you can attach a Gantt chart if you wish to do so. So in terms of ethical considerations, please explain any ethical issues you believe are relevant to the proposed research project, and what ethical approvals have been obtained and from whom, or what ethical approvals will be sought if the project is funded. If you believe an ethics review is not necessary, please explain why. We'll be looking at whether ethical and research governance issues have been appropriately identified, and whether there are satisfactory plans in place to address any ethical or governance issues. Are there clear plans in place for storing and, if appropriate, sharing data in accordance with GDPR? So what information is required about intellectual property and contracts? So in terms of IP, how you've considered the IP implications of the project and how it will be protected, any patents or agreements that you have in place currently, any disclosures that will prevent the protection of relevant IP, any existing arrangements with third parties if relevant, including funders of work to date who may assert their right to IP. And the question you'll be answering this on the funding application form is, what pre-existing intellectual property rights are to be used on the project and will they be improved? Will any new rights be created? So the key dates. The funding call opened on the 9th of July 2019 and we held our first webinar on the 23rd of July 2019. And if you wish to watch the first one, then that's on our YouTube channel. The second webinar we're hosting now, and we will then be posting that on our YouTube as well. We've got a sandpit event on the 9th of September 2019 and we'd really urge anyone who's interested in applying for our funds to attend the sandpit event. The funding call application deadline is on the 30th of September 2019. And once again, we'd really encourage people who are interested in applying to come to the sandpit event, meet other potential collaborators and develop your application. Okay, so we've got a question from Andy about what's a sandpit event. So the sandpit event will really be an event held for people to network and meet other collaborators, people who are interested in applying for funding. If you're looking for a partner, then you can there's the opportunity of meeting a partner at the sandpit and working together to collaborate and create an application. There's also the opportunity to get some feedback from people involved in the network on your ideas for your application, what your ideas might be, the opportunity for a bit of networking with other people involved in the networks, and really it's just an opportunity to meet people and develop your project proposal. So the next poll was, do you already have a formed idea for an application? So we've got a mixed response here. Some people have an idea and some people don't have an idea yet. If you don't have an idea but you have a rough idea and you want some support, do get in touch with us. So we're now going to move on to some application tips from a panel member. So I'll introduce Professor Karen Bloor, who will talk to you and give you some tips.
Thanks, Emily. My name is Karen Bloor. I'm a Professor of Health Economics and Policy at the University of York, and I'm the university's research champion for health and wellbeing. So I work across York to help and encourage and facilitate interdisciplinary research in the whole area of health and wellbeing. So it's a real pleasure to be part of the Closing the Gap network and to be with you today. I'm no more expert than many others on application for this, and as we haven't yet had a panel, it's hard to give really detailed advice on this particular scheme. But I think there are a few things you should bear in mind. You've got in the guidance notes for the call, there are some quite clear assessment criteria. So when we're on the panel, these are what we'll be using and what we'll be using to score your application. And predictably, those are around research excellence. So perhaps novelty and importance of the overall research question that you're trying to address. Feasibility is important, especially with these small grants. These are relatively small. It's sort of 10 to 30,000 grants. So we need something realistic in the time and with the resources that you'll have. And of course, we're really keen to see new research collaborations working across different disciplines, different teams working together that haven't done that before, and working across higher education institutions, but also with external partners. I think Emily's already talked about value for money and ethical issues, but of course those will be part of our application scoring as well. The other things to bear in mind are, I guess, a fit with the spirit of the call. So with the core principles of closing the gap, which are around inclusivity, innovation, engagement, that kind of thing. So remember what the whole network is trying to achieve. And
fit with the primary thematic areas. Again, you're familiar with those, I'm sure, but green and blue spaces, big data, digital tech, creativity, social inequalities, knowledge mobilisation and research and practice. There's lots more information on those themes on the website. I guess a couple of tips for filling in the form itself. It's a pretty short form. Shouldn't take anybody too long. It's it's a proportionate to the amount of money, and it's pretty concise. So keep your answers concise as well. And I think one of the things that I repeatedly see on funding panels is lay summaries that are completely incomprehensible, and that drives me nuts personally as a panel member. So for any panel that I'm on, write a lay summary that anyone can understand. And I guess the other thing to say is to contact the team, contact any of the support staff or any of the theme leads if there are particular bits of advice that you'd like help and support with as you're completing the form. So we're all really excited about the network. We're really excited to see what new ideas, what new collaborations, and what projects you want to suggest. Looking forward to being part of this panel and part of this network. So I think unless there are any specific questions at this point, I'm going to hand on to Piran White. Piran, are you there?
Thank you, Karen. Yes. So it's back to me, and I'm just going to finish off by saying a bit more about some of the specific questions. So the call document itself gives a bit of an overarching aim of what we want to do with this first call, but what we've been doing as part of the network is working closely with our stakeholders to develop some specific questions that are really priority questions for across our stakeholder group. So these are all listed on our website, and they're also listed at the end of these slides. So what I'm going to do, I'm not going to go through all those in detail in the interest of time, but what I will do is say a bit about the process by which we've come to define some of these research questions. So early on in the project, when we did our launch earlier this year, we held a World Cafe event, and this brought together academics with people in practice, but also policymakers, other organisations involved in mental health and severe mental illness. And we held a series of roundtable discussions that were led by our research foci and cross-cutting themes. And we did this to ensure that everyone had a voice. We could connect all the different perspectives. People could move around between the tables, listen to everyone else, share their views. And the idea for this was to identify topics for research that we could identify specifically within these different research foci and research themes. And following that, we then went away to consider all these topics in more detail and basically try and pull them together in a way that we could arrange them to within our two main aims of understanding the causes and consequences of the gap and identifying the most effective ways to mitigate these. So we sorted our topics out into these different areas, and then within each of our research goals, we identified 3 research questions, which we then went back to with our stakeholder group in a prioritization workshop. So these questions have been co-developed in the sense that we've developed the topics initially with our stakeholders and then refined the questions with them. So what the next series of slides do is identify these very specific questions that relate to some of our overarching aims. So, for example, on this slide, the aim, which is in relation to causes and consequences, is to understand how people with severe mental illness perceive and use green and blue space, the effect on their health and well-being, and how that varies with the population as a whole. And then within that, we've got these 3 specific questions, one of which relates to how people with severe mental illness perceive, use and benefit from green and blue space. Then we've got the question about formative childhood experiences and how they affect these perceptions and patterns of use. And then we've got a question relating specifically to type and level of activities. And And then if you look at the next one, this is relating to integrating data sets on health status and use of health services. So again, we've got 3 really specific research questions, one of which relates to the prevalence of severe mental illness and associations with green and blue space at different scales. Then the next one's about how inequalities vary for different conditions and groups. And then the next one is more related to the health and social care system. So we've got these very specific questions. We've identified the top 3 questions, both for our A series of questions and then our B series of questions, which we come on to now, which are more about mitigating the causes and consequences and looking at developing initiatives and so on. So if you're struggling for research questions or want some bit more guidance about research questions you could really focus on to try to develop a project, if you consult these questions on the website, then this might give you some extra guidance to some of the things that we're really interested in looking at. So I will now hand back to Emily.
So we can answer some of the questions. Just bringing the questions up now so we can see. The questions are, sorry. The first question is around feasibility. So quick questions. Is there a maximum number of partner organisations allowed to be involved per application? There isn't a maximum number, but when you're making your application, you probably need to think about feasibility and is it feasible to have that number of people. So if you've got 10 partners on and you're asking for £2,000, then that probably doesn't seem very feasible. So just think about your application and the number of partners that seem realistic and feasible, and how many partners you need and who you really need to take part. So Andy Milsom's asking, are you advising we use one of these questions? I assume that that's one of the research questions that Piran was just talking about, and yes, we really would suggest that you're looking to answer one of the research questions that we've highlighted as the key questions. However, if you have a question that you believe to be really important, then we wouldn't necessarily discount that if it did turn out to be important and it's something that we've overlooked. So we don't want to shut anything down if somebody's got a really good idea that we've just happened to overlook, but we are suggesting that those are the questions that people should be looking to answer. So should the application be submitted by the PI or the research office? The application should be submitted by the PI, please. So we've got a question, what's a sandpit event? And we answered that question earlier, but just in case anyone missed it, so the sandpit event is really for people to come and meet each other, meet with other potential collaborators, meet with other people who are interested in applying, and if you're looking for other collaborators, meet people there, get some feedback from people who are involved within the network, and really just a sort of networking opportunity and an opportunity for people to develop their application with some support. You have any virtual events for networking? So we were thinking about this, and I know in the NAS webinar somebody asked us about virtual sandpits, and we're thinking about how we might go about this, but we're wondering about hosting some sort of on the sofa type activity, a virtual sofa where a few of us are on the sofa and people can come and ask us questions and we can sort of facilitate people meeting each other. So that's an idea that we're having, and we're just going to explore that in a little bit more detail to see whether we think that that's going to be feasible. We thought that might be a nice way of people being able to interact with us virtually. We really would encourage people who want to apply to come to the sandpit and meet us face to face in real life, but I know for some people that might not be possible, so that's why we're considering these virtual events as a way for people to talk to us in a virtual environment, so that we're trying to be as inclusive as possible, as one of our core principles is inclusivity. Okay, so there's another question. Will the panel give feedback on unsuccessful applications?
Yes, I think there'll be at least a brief, a brief summary of feedback.
Yeah.
On both successful and unsuccessful.
Yeah, yeah. And are you using a standard definition of SMI? So the definition we use is the definition that GPs would use for their primary care quality outcome framework register. So that is people with schizophrenia, schizoaffective disorder, bipolar disorder, and non-organic psychoses. People with dementia are not eligible. So that's the definition we're using as SMI. if anybody wants more details of the definition, please just get in touch and we can give you the F codes and more details like that if you wish them to have them. So the question about our cohort, should we use our cohort, or are you able to recruit your own people? It's fine to use your own people. Really, it depends what your research is as to what would be the most appropriate. And if you want to talk to us about the cohort, then please get in touch with me and I can give you a bit more information about the cohort, but you're welcome to recruit your own people if you wish to do so. Okay, so thank you everybody for joining the webinar today. As we've said earlier, please get in touch with me, Emily, or any of the theme leads if you want any advice about a particular theme. Happy to help and really looking forward to receiving your applications. Thanks very much for joining us today.